as you can see, this was very comfortable. I didn't use any topical anesthesia, no local anesthesia, no form of anesthesia. So this patient has been very comfortable throughout the process. Right, sir? Hello everyone. We're here today to talk about an exciting new product that we're going to use now with our patients, which helps us to provide additional anti-aging properties to the skin. It's one of the new tools. And before I start, let me welcome Sarah.
Thank you.
Welcome, Sarah.
Thank you, Dr.
Sarah is our volunteer today. She's kindly agreed to volunteer to try this new product with us.
Yeah.
Today we're talking about Profhilo Structura. You all know Profhilo. Profhilo as a product has been in the market for many years, and it's been an original product that we've been using now for a few years. It has proven to be a very effective product in anti-aging, in helping with hydration, in glow, increasing elasticity, even in providing minor lifting to the skin. And in my practice, I find it very popular. It's very well liked by patients. There's a high retain of patients when they come back and they ask for it again and again. It's very simple to do. I haven't seen any side effects. So this all adds to the benefits of this product. As we all know, Profhilo is basically hyaluronic acid, which is high molecular weight hyaluronic acid, which helps to increase the hydration, the glow. So what's the difference between that and the new product, Profhilo Structura, which is the product we are to show you today? Profhilo Structura is simply, again, based on hyaluronic acid. It is different from Profhilo because with this product we can target volume loss. We can target the fat loss in the skin, which is one of the major components of the aging process. And it allows us to treat various shapes and types of skin. And that also adds to the benefits of this product. With Profhilo Structura, we can target specific areas of weight loss. Nowadays, there's a lot of people who are maintaining a healthy lifestyle. They're trying to lose weight. There's a lot of athletic people. Here we have Sarah. Sarah is a cyclist. She's a professional cyclist. So that makes her someone who burns fat easily, loses fat easily, and that applies to the body as well as the face. And we can look at Sarah's face and we can see that this is the face of somebody who's very active. I mean, she has quite thin face. She doesn't have big cheeks. You've had some work done in the past, Sarah. It's very subtle.
Yeah.
So probably a bit of Botox, some cheek fillers have been added, but in a very subtle way. She worked a bit on her lips. But if we look at Sarah's lifestyle, we know that she will continue to lose fat. And in her case, it's very good to work towards fat loss. We want to maintain the adipose tissue in the skin, and with Structura we can achieve that doing very simple treatment. Profhilo Structura, we usually recommend that you do 2 sessions. We will start with 1 session today, and we'll probably bring you back in 4 to 6 months, do another session, and that probably is all you're going to need. Now, people age in different ways. People with faces like Sarah usually people who tend to sink with time, so they're going to have a bit more bony prominences. She will lose fat from the sides here, and then the central part or the medial part of her face is going to look very heavy. And that is why if I want to work with somebody like Sarah and I want to give her a more youthful look, I want to actually elevate this area. I want to create more support on the sides of her face, and this is very important. Nowadays, it's all about natural looking people, natural beauty. We are far away from, giving them an overfilled look, which used to be a thing in the past. Yeah, not many people want that nowadays. So we want to keep that natural, and I think, and I truly believe, if we work with the anti-aging process, try to target each part that works into aging, we are improving the skin in a much more natural way. So with Structura, we're going to target your fat loss. So you can continue to enjoy your exercise and your cycling, but at the same time you still have a youthful look because you are still young and we don't want you to look older than your age. Now this is the product. As you can see, it comes, I mean, there's always an issue with a product and original products, so we always say be careful that you are dealing with the original product, you're using the original product, and this is very important, especially when it comes to aesthetic medicine nowadays. This is a product where you actually, it comes to you that is sealed, and this is very important, so never use any product that's not sealed, and that's something I always say. So this is Profhilo Structura. We're going to work now, we're going to assess the patient, we're going to basically mark the skin. Of course, we've taken a full history ahead from this patient. We make sure that they don't have any other health issues, they're not on any medication, no allergies. Of course, you have to know about the previous treatments done in the recent 6 months. It's very important. Just don't ignore these facts because this is a safety issue. Now, if we look at Sarah's face again, now that she's facing us and she's more rested, Sarah is likely to lose more fat as she ages because she's likely to lose fat from her temples. So maybe we can get the camera here. So these areas, people you lose more fat as we age. So this is an area of fat loss, and this is another area of fat loss. So people usually lose the fat as well from these two areas. And if we look at these two areas, this is basically the size of the face that provides us with more support. So if I don't have enough support here, I'm more likely to develop this. I'm going to have medial heaviness, I'm going to have the jowls, and people will look more old or older. This is all signs of aging. So what I want to do with the Structura is actually give you more support here. Yeah?
Great. Excited.
Now, you might ask, can I do other treatments with this patient? Yes, of course. And sometimes you want to replace a bit more of the volume loss. So what we do is we put a tiny bit of filler, for example, strategically placed. Now with Sarah, we've done some filler in the past, and we always want to keep it very natural. So don't overfill, don't overuse fillers. Fillers are a beautiful tool, but needs to be used with ease and needs to be injected not so frequently. And this is the beauty now of having other products where we can combine with our fillers, with our Botox. So we don't have to go back always to fillers. We can always work with things like Profhilo, with, for example, collagen stimulation techniques, with even with our machines, with our lasers, with our radio frequencies, with our fractional lasers. So I think with each patient we can actually combine more than one treatment and choose it and put a treatment plan. Basically put a treatment plan for your patient. Decide what is important, start with it, and go through that treatment plan over time with your patient. This just ensures or guarantees the actually most natural, long-lasting results you can achieve. So now we're going to come to decide where our injection will be. Now the nice thing with Profhilo is we inject it with a cannula. Cannula is an excellent way to inject Profhilo Structura because we're targeting the adipose tissue. So we want to go more in the subcutaneous fat. So cannula is a safe way to approach that area. Ideally, you would come basically, will take basically 2 centimeters away from the tragus, and then you will inject downward in this direction. I tend to avoid going all the way down to the angle because you don't want to create heaviness here. Remember, we are trying to stimulate adipose tissues, so I don't want too much fat here. So I'm going to concentrate my treatment in that area because this is what I want to do. And we are aiming to putting 1 ml in this area. So this is 1 ml that will go in this location. I'm going to do it on the other side. I'm going to come down and then again I'm gonna work with that shape. So we're gonna make an entry point here, small prick, 1, 2, 3. You're okay?
Yeah.
Well done. Of course, we're not using any numbing, so this is actually a comfortable treatment. So we go with the cannula. We're using a 22 gauge. You're okay?
Yeah.
So make sure you're in the right plane. Now usually you know when you're in the right plane because it gives way. That giving way makes you feel more safe. You're okay?
Mm-hmm.
Well done. So I always try to feel the end of the tip of the cannula. Always feel it. This is more safety. Never inject blindly. Now in the Profhilo Structura we have a 2 ml, so I'm going to inject 1 ml on this side. Now remember, it's a thick hyaluronic acid with a G prime of 95, so it's not going to be very smooth to inject. You're going to have to push a little bit harder when you are injecting, and that resistance is fine. You don't have to be very quick. Take your time. Okay, so now we've injected 1 ml. Now I tend to immediately clean, and then I kind of massage very gently. You don't have to massage it as much as push it. Basically you just push. So I'm just pushing to smooth out my product. Now again, it is a smooth product to use, so doesn't feel lumpy or anything. It just actually feels good. You're okay?
Yeah.
Did you feel that?
No.
Any pain?
No.
No. As you can see, this was very comfortable. I didn't use any topical anesthesia, no local anesthesia, no form of anesthesia. So this patient has been very comfortable throughout the process. Right, Sarah?
Yes.
And if we look at this side and this side, this is where we didn't inject, this is where we injected. You can see that there is a little bit more projection here. A nice thing to do is to stop halfway. So you've done one side.
Yeah.
And now I'm not going to continue. I'm going to give you the mirror. Hand your patient the mirror. Let them have a look. So, do you feel you see a difference?
Yes, I can feel
Yeah,
it.
yeah, you can see it. Of course, I'm not saying this is the final result. It's going to get better over time because this is actually a process of improving and building up your adipose tissue. So it's not an instant effect. But the benefit of stopping halfway through and letting your patient have a look. First, you actually are reassured that you've placed the product in the right place because you can see where you've put your product. Second thing, patients become more happy because they are part of the process. They are part of what you're doing. So you are taking them through what you're doing. You're teaching them while you're treating them. And this is very important because this gives them also more confidence in you as a doctor. They like you more, they'll come back and do more treatments with you. So this is part of gaining the confidence of your patient. So, happy?
Very happy.
We can continue now?
Yes, please.
Look at the other side, Sarah. So we'll do the same thing. We'll come almost like basically 2 centimeters away. So we will again massage it شوية. Actually more pushing it than massaging. So I usually push, make sure that I have it where I want it in the deeper layers. Okay, that. Now the massage is optional. You don't have to, but I always end with a massage. For me, it's good because I feel the products where I've placed them. At the same time, it is a nice gesture to your patient. So your patient feels more comforted at the end of the treatment. Do you feel anything, Sarah?
No.
Any pain, any heaviness?
No.
So nothing basically. So it's a simple treatment. It's basically no downtime. Usually you can tell your patient there might be some swelling in the first 24 hours. Very minor, I wouldn't say it's major. It's better to avoid exercising for the first 24 hours. No going to places like steam, sauna, just avoiding extreme heat temperatures. Other than that, they can have a normal life, go back to their daily life, use their products, and see them again in 4 to 6 months. So, Profhilo Structura, I think that's another nice tool to use to help improve our patients, reduce aging signs. It will increase the volume, basically combating volume loss, especially in the adipose layer, which is the deeper layer of the skin. A question where people sometimes ask, if I do Profhilo Structura, do I not need to do Profhilo? Well, it's completely different. Profhilo alone, we use it basically for hydration, for laxity, for glow. I love it. I give it always to people who have occasions. When people come to me and say, I have a wedding, or I'm traveling and I need something to show, I do Profhilo. With Profhilo, you can achieve very subtle lifting of the skin, tightening, nice glow, and it will last them anything between 3 to 6 months, depend on their lifestyle. But when we use Profhilo Structura, we are aiming at the volume loss. We want the skin to restore the fat it lost. Nowadays, a lot of people are losing weight, a lot of people are exercising, so a lot of people have fat loss. And with fat loss, you cannot replace that using just fillers or skin boosters. Structura will give you a solution for that.